we're going to move on out of that. You go into that kind of subacute stage, and now you're going to have radiation. Then this is another huge element on. So while radiation happens, it's going to create this tightness on the chest, so you may have start having some shortness of breath because you don't have the ability to really expand your chest because this fibrosis is happening in there. So
Mhm.
that's super important as well. Or, you can have issues as well, like swelling on the trunk post radiation. Radiation can create a lot of damage into the skin. So we're so lucky that we see everybody who goes through radiation. We get a referral for everybody who goes through radiation. So we see them early on again in the beginning, and we're able to give them education and look for these flags, and then we can start teaching them an exercise program to get things moving, right? And then to prevent or mitigate a lot of their side effects. If we look into chemotherapy, again, some patients is like, well, I'm expecting from chemo, yeah, to lose my hair in some of the chemo drugs, have this neuropathy, but it's to expect is, I'm going to get better. And all of a sudden you're falling or you feel really unsteady. So again, look for physical therapy because there's a lot of things we can do for neuropathy and help you with your balance and try to avoid those. It's a really good example of this, which is at the same time, it's a little bit sad, but we had a patient who she had chemotherapy and unfortunately was not sent to PT. She developed neuropathy, and then unfortunately they were like, well, that's part of the regimen. Just kind of like, yeah, we'll get better. And as she was walking, she had chemo prior to surgery, and as she was walking the morning of her surgery, she fell and broke her arm, the opposite arm. So here we go, right?